Ano?
May klase ako ngayon. Oo. Asan kayo ngayon yan? Nasa
Nandito
center?
lang po sa labas ng campus.
Ah.
Ay, ma'am! Ma'am, lalabas na ako. May klase na po kayo.
Oh, sige, okay. Okay, bye-bye. Thank you. Akala ko galing ito kay Ma'am ano. Sige, thank you. Okay, bye.
Sige po, sige po.
See you sa Sunday.
See you.
Hindi naman pwede. Hindi kayo pwede, inay. Senior kayo.
Wala pa. One.
Sino kausap?
Sorry po.
Sino yun?
Sabi ko si nanay ko. Kasi may patay akong pinsan na ililibing ko bukas. Sabi ko hindi pwedeng sumama makipaglibing kasi senior na
bawal.
siya.
Wag na. Ang taas pa naman ng rate ng
Ayan.
ngayon sa akin.
Kaya
Mabuti
nga
kung
po eh. Kaya sabi ko wag na
magkasakit ka
sumama.
nun, tutulungan ka nila. Hindi ikaw ang may sagot doon sa mga ano mo. Kulang pa tayo. 1, 5, 6, 7. Wala na pala. Sino ba yung wala na? Si Irene, no? Si Irene yung nagpaalam, di ba?
Oo, ma'am. Umalis na.
Opo.
Saan na tayo? Sandali lang ha, magano muna ako ng slides natin. Do you any questions? Sus, you have any question?
Oh, ma'am. Thank you.
May quiz po ba, ma'am?
Ha?
May quiz po ba?
Wala pa.
Saan pa bigla?
Okay. Dito tayo sa specimen collection. So there are so many things for specimen collection. We have the urine collection, stool, sputum, the wound drainage, the blood. Also, what you are going to do. You have to comfort the patient when taking the blood or any specimen for the patient. You have to take the privacy of the patient. You have to put the curtain like that and let no one be yung mga stranger na nasa kanya. You have to ask question if it's painful or what you are feeling, if you are happy or not. You have to also do a clear direction, a concise direction for the patient, and always tell the patient ask if they are fasting or not fasting. Now, always on our part, if it check if it's an order of the patient, and if it's also you give simple direction for the patient, and also you have to observe precautionary, like you have to wear mask, you have to wear gloves that will protect you, and then also you have to label the specimen, and you have for the patient, you go, you bring immediately to the laboratory so that it will not be spread. Those are the specimen immediately and keep refrigerated, and always keep documented all the specimen that you are going that you get from the patient, because when you are testing for the random urine test, it must be clean. You have to note if it is the female has menses or anything that he has taken in, because they have to check for the specific gravity, if it's acidic or not acidic, check of the presence of albumin or glucose. And for the culture sensitivity, if there is a questionable growing bacteria, and also for sensitivity test, which is to check which antibiotic is effective for the patient. And in reading for this urine or culture sensitivity test, it must be 24 hours, 48 hours, 72 hours. And when you get the specimen of the patient, it must be in a midstream urine sterile catheter. Specimen never take from the bag. Parang dalawa to. And also for the specimen for culture sensitivity test, for the patient who having UTI, you have to check for the frequency, urgency, dysuria, hematuria, flank pain, fever, and cloudy and malodorous urine. And you have to wash your hands in obtaining the specimen. Also, you have to wash your hands, clean the meatus. Alam mo, you know what is meatus? It's in the urethra of the patient, dun sa pinaka-organ ng patient natin. So, you have to, the female, you have to start collecting it from, collecting the specimen, start in the midstream, and use aseptic technique, give bedpan or Mexican hot. It must be given to the laboratory 15 to 20 minutes post-collection. And for pediatric, also pediatric bags and never squeeze for the diaper for the patient. The characteristic of urine may be the color. You have to check for the color, clarity, and the odor. And for the random specimen also, napkin sterile. I think this one I check it already, this one. Now, in measuring for the properties of the urine also, we are checking for the glucose, ketones, protein, blood, if there is any hematuria or blood, the pH, specific gravity, or for microscopic examination. For the stool also, this is an analysis of fecal materials that can detect the condition of if there is any tumor for the patient, for hemorrhage or any infection. This test, they will check if there is an OV, if there's any pus or ova or any parasites in the urine, in the stool of the patient. So this is how it looks like. And the fecal specimen is that they use for a chemical preservative. Medical aseptic technique also is done. You have to bring in the laboratory on time. You have to label it and document it also. The test, colorectal cancer screening test. The fecal characteristic, you have to check for the color, if there's any blood or melena. You check the odor, the consistency, the frequency, the amount, and the shape of the fecal. This one, it's the fecal test. Single positive test result does not mean you are confirmed for bleeding or colorectal cancer. This must be repeated 3 times. A patient must be meat-free and high residue diet. Now, for the vaginal intrauteral discharges also, this one, non-purulent whiteness or color small amount. And this one, we are collecting vaginal discharge for the signs and symptoms of sexually transmitted disease or urinary tract infection. This could not be delegated. You are the one who will do or who will take the specimen for the patient. You could not delegate to the relative or the family of the patient. You have to assess the external genital of the patient. If the sexually transmitted record is positive, you have to record the sexual history of the patient. If the patient has a multiple partner, or if there is any anything regarding how he clean his organ like that, or and also for the physician, it must be a physician order for the vagina or uterine collection. For the blood specimen, only the laboratory technician could get the blood specimen, ABG, and for the blood glucose. Also, we are collecting for cerebrospinal fluid, and we are taking fluid in the cerebrospinal. There is a spinal needle that may enter into the spinal of the patient. For the respiratory tract, you have to determine the abnormal cells for infection. You have to take the throat culture, sputum specimen, skin testing, and thoracentesis. Now for the throat, the upper respiratory or throat infection, you should not be delegate also. You are the one who will do for this one. And the throat swab, this one before meal or 1 hour prior to meal. You have to wash your hands, and then you wear gloves also. You have to tilt the patient backward, and you instruct the patient to say because if the pharynx could not be visualized, you have to use tongue depressor anterior 1/3 of the tongue. So you tell so that you could visualize the throat of the patient. The throat culture also may be included the oropharynx or tonsillar, sterile swab, culture determining pathogenic or microorganism. Sensitive determines antibiotic, which microorganism sensitive is resistance. Usually we are doing this one sensitivity test so that we could check which is the medicine, which is the patient is responding or not responding, so that we could give you the effective medicine for you. And for the method for throat culture, you have to insert the swab into the pharynx region. If there isn't any readiness in that area or any exudate, you have to take the notes also. And gag reflex, if the patient is sitting or leaning forward slightly, inform the patient for procedure also. For nose culture, you have to ask the patient to blow his nose to check his nose patency. Now, when you put the swab, you have to rotate the inflamed nose or exudate. The swab must be advanced into the nasopharynx to ensure the culture is properly obtained. Now, the sputum specimen, major type, order, identity of organism, which is growing in there for the culture sensitivity, and AFB for 3 consecutive early morning. The cytology is for the abnormal lung cancer by cells type. It should be taken at early 3 a.m. also. The sputum collection must be delegate. Yeah. For the collection for the sputum, you could delegate to the relative. You have to ask the patient to cough effectively. Mucus must be collected from the bronchus, not saliva. You have to record for the color, consistency, and the amount. Now for the sputum collection, instruct the patient not to use mouthwash or toothpaste, which is viable for
Parang tapos na yan, ma'am.
Tapos na ba? Hayaan mo na patapos ka. Viable for the microorganism to alter the result. For skin testing, also determine the pulmonary disease, bacteria, fungal, and viral. Antigen injection to intradermal. For the injection site, once you are having this skin test, dito sa site na dito ng hands mo iti test, which is there where there is no vein, and then they will insert for you a little amount of antibiotic, and then they will encircle it and instruct you for not to wash or do not touch. In duration for the skin test, if there is palpable, elevated, or hardening in that area, or edema, inflamed, now the positive is it is positive. So they will not give you for that medicine. So if the reddening it is flat, the area is negative, so they could give that medicine for you. The early frequent display for the false negative for positive, the skin test. For the positive TB test, complete history of risk factor. You have to check for the symptoms, weight loss, night sweats, hemoptysis, yung pagsuka na ng blood, and then pag-spit ng blood pala, and fatigue. Early, you have to take the specimen, before eating the patient, you have to also do chest X-ray. And then the thoracentesis, you have to insert needle through the chest wall into a pleural space and aspirate fluid. This may help for the diagnostic of the patient, the therapeutic also, and for the biopsy of the patient. Dito na ata tayo na for gastric secretion for NGT. Food culture, culturette swab, wet or dry method, nose or throat or wound. You have to review the procedure manual to fill up the requisite. And in nursing function of this specimen, you have to explain the procedure to gain the patient participation. You have to collect the right amount of the specimen at the right time. So you have to collect the right amount. Wag yung konti, but it's just amount which is enough for all the tests of the patient and at the right time. You have to place in a correct container, which is the aseptic or sterile container. You have to label it accurately and put in a plastic bag and complete the laboratory request and place the specimen in appropriate for pick up. For blood glucose level also, there is the capillary puncture. Reduce the venous puncture. The client can perform the glucometer and chemical reagent strip. Delegate those who instruct. If skilled, patient condition will be stable. So, and glucose monitoring, this must be ordered before, after, hour before the sleep. It must be fasting before the insulin will be given. Now, there is a slight scaling also for that one. Risk for the skin puncture also, because the patient, when you are taking it, you need to assess the area of the skin, side of the fingers, the toe, the heel, and client availability. The normal blood sugar measurement is 70 to 120 milligram per 100 ml. Now, this is the way when you take for the blood glucose of the patient. Ganito siya. This is usually we're taking for the diabetic patients also, when you're handling the diabetic patients. So glucose monitoring, you have to wash your hands, you have to wear the gloves. Client also, you have to wash the hands of the patient with warm water, and then follow the instruction on a meter, and then massage or milk the finger or the puncture site, and then antiseptic swab. Allowed to dry it completely. You may alcohol swab ba na ina-apply muna, and then wipe it first, and then drop of blood with tissue or cotton balls. Now, the glucose monitoring is, we have a disposable lancet in sharp container also. Once you are done, you have to put in that container sharp. Yellow, that is, the color is, the sharp container is yellow. Now, after that, you have to wash your hands again, check the puncture site, and can share the reading of the patient. Because once you have to prick the hands of the patient, the result may come immediately. And you have to tell to the patient, and then record the result. Then proceed as indicated by the result. Now, the value of measurement. There are 3 benefits of measuring the progress and the result. Now, it shows where you are now, and it tells you when we are heading toward for our goal. It allows also to make an improvement along the way. So, measuring the glucose is very important. You have also you have to record it for your so that you know you reach your goal, that you are progressing. What we measure, it gets to improve. Now, you have to heighten our awareness. You have to help to focus on what we value, where we are going. Keep us on track also. We need to have the record of our glucose monitoring. You have to give information what is happening along the way. You have to tell to you when you are working at home who have diabetes, and enable to us to continue or change depending on the desired result of the patient. Now, that's all for the specimen collection and for the glucose monitoring. Now, we will go to colostomy care. Any question? Hello, any question?
Wala
I am
naman.
very fast. Very fast.
Wala na po.
Fine, no,
Yeah.
ma'am. Thank you.
Okay. Now we will go to colostomy care. Now our introduction is that the word ostomy, meaning to say opening, which made during the surgery that brings to the piece of the bowel, intestine to the outside of the abdomen or on the belly. Now, a colostomy may be a temporary or permanent. It is most permanent colostomies are and or colostomies. Many temporary colostomies bring the side of the colon up to the opening of the abdomen. Why we are usually have this colostomy? Because a colostomy is an opening in a large intestine brought to the surface of the abdomen for the purpose of evacuation of bowel. Usually, the colostomy patient could not have evacuate for their bowel, so they may have this impactation of the stool. So we have this colostomy, opening of the large intestine that brought to the surface of the abdomen, so that the bowel could be evacuated. There are two types of intestinal ostomies, which is the gastrostomy, which is an opening through the abdominal wall of the stomach, and the other one is the jejunostomy, which open through the abdominal wall of the jejunum. This is in the intestines. Now, the indication for ostomy. This one usually at birth defect or usually at the congenital already. Some patient have this birth defect. Since birth, they have already imperforated anus. That's why when the patient, when a child was born, we are taking the body temperature per anus. We put the temperature in the anus of the patient so that you could check if the baby is having imperforated anus. Because if you will not able to locate or there is no any opening in the anus of the patient, the problem has a defect on the gastrointestinal of the patient. He could not pass stool. Another thing is a serious infection, such as diverculitis. Also for inflammation of bowel disease. Also injury for a colon or rectum, or partial or complete intestinal or bowel blockage, rectal or colon cancer, or wound fistula in the perineum. Why colostomy? Because there is a birth defect or there is a serious infection, there is an inflammatory and bowel disease, there is an injury in the colon or rectum, there is a partial or complete intestinal or bowel blockage, there is a rectal colon cancer, wound fistula, perineum. Now, some of the most common conditions that might necessities for stoma. Usually, this imperforated anus, where there is no excess of bowel of its content. Usually this one when during the delivery, may we found that a child don't have an anus. We usually check for the patient in anus. Yung first na deliver ng child, agad-agad we check for the body temperature per anus. Now, another one, yes? Another one is a hair-sprung disease, where nerves called a ganglion nerve are missing and waste matter cannot easily pass. So we are doing also for that one. Inflammatory bowels include the Crohn's disease or ulcerative disease, or colitis, both inflammation disease of the intestine. This is how it looks like, the colon cancer. This is how it looks like, the tumor. So the feces could not pass directly to the anus because there is already ulcer there. So that's why they make an opening for colostomy. This is the hair-sprung disease. There is an enlarged colon, the nerves there. Collapse na yung rectum niya, and there's no nerve anymore. And the ulcerative colitis, this is how it looks like. Now, in neonatal, meaning to say in infant, necrotizing or endothelitis, this occurs when a portion of the bowel is dead and cannot function. And the most common in premature babies who are weighed less than 3 pounds at birth. In this case, the stoma can mean life to a baby. So they are doing this colostomy. Spina bifida also, where a part of the spine fail to develop properly in more than a severe form of the disease. The spinal nerve that control the muscles of the legs, bladder, and bowels may be affected to stoma needed. So, neonatal who have necrotic enterocolitis for spina bifida, they are performing this colostomy. This is how it looks like the digestive system of the patient. Anyway, you have this one later on. Now the location. The most common placement of a lower side is near the sigmoid, where the majority of the colon cancer occur. Saan ba yung sigmoid yan? Usually in this sigmoid part, this one, sigmoid part, is the common part where they're doing this colostomy bag. Now, there are two types of colostomy. The one is a loop colostomy or the single barrel colostomy, and then end colostomy, double barrel colostomy. So, ayan po siya. According to stoma site, there is ascending colostomy, descending colostomy, and transverse colostomy. Ileostomy is an opening that made in the small intestine, the ileum also, and the end or the loop of the small intestine is brought through the skin surface of your child abdomen and output then pass through the stoma. The ileostomy also will resemble the spout because the wastes are more liquid due to the fact that ileostomy output contains digestive enzymes that can be harmful for the skin. Ito siya. Now, the management for the patient with the colostomy. In preoperative nursing care, psychological preparation, you have to prepare the patient who have this undergone colostomy. Assure the patient that ostomy can be cared for without interfering our daily activities and social life. You have to encourage the patient and reassure that even though they have this ostomy or colostomy bag, they can perform their ADL, daily activities, and then also for their social life. The only thing is that the nutrition is a low residue diet and given for at least 1 to 2 days prior for the surgery of the patient. Now, care of the bowel. There's a need for sterilization of the bowel prior to surgery to reduce bacterial or floral can be achieved through administration of poorly absorbed antibiotics such as neomycin. 1 gram per hour for 1 to 3 days laxative enema should be done. The bowel should be clean at that time for the surgery. Now, for the post-operative nursing care, you have to check for the skin care. You have to assess the skin for the irritation or breakdown. You have to apply the skin barrier paste. To control the odor. Control the odor by clean or odor-free or well-fitting appliance. Regularly change the bag, clean it, and use deodorant. You have to apply an ostomy appliance. The stoma must be measured so that the right size of appliance can be chosen. The pouch that attach over the stoma is fastened and onto the face plate. the medication. Some medication or nutritional supplement may change the color or odor or consistency of stool, just like before the surgery. The patient educate the post-medication and observation are therefore necessary for them. Now, the product used for colostomy, there is a pouch. This pouch is have a variety of size and styles of ostomy pouches. The pouches are lightweight and odor-proof. Pouches have a special covering to prevent the pouch from sticking on the body. Some pouches also have a charcoal filter, which release the gas slowly to help the decrease of gas odor. The following general information about the types of colostomy pouches. There is a number one, there is an open-ended pouch. This type of pouch allows you to open the bottom of the pouch to drain the output. The open end is usually closed with a clamp, and the open pouch is usually used by people with ascending and transverse ostomies. The output from the colostomist is a looser and unpredictable and does not drain at regular times. But the closed-ended pouch is a type of pouch that can remove or thrown away all the pouches that is filled. Closed-ended pouch is usually used by the I cannot say anymore because of this one. Now, one piece pouch contain the adhesive skin barrier together with as one unit. The adhesive skin barrier is a part of the pouch system that is placed around the stomach and attached to the skin. When the pouch is moved and replaced with a new one, with the new pouch must be reattached to the skin. There is also a two-piece pouch has two parts, the adhesive flange and the pouch. The adhesive flange stay in the place while the pouch is removed for a new pouch to attach to the flange. But the pouch does not need to reattach. The two-piece system can be helpful for the patient with skin or sensitive skin. The pre-cut or cut-off fit pouches, some pouches have the pre-cut holes, so you do not have to cut the opening of yourself. Other pouches can be cut to fit the size and shape of the stomach. Cut to fit the pouch are especially useful for right after the surgery because your stomach decreases in size for about 8 weeks. Now, there are purpose of colostomy care also. You have to take care for the skin protection and care. You have to receptacle drainage, and the patient acceptance for self-care. Because it's very, sometimes patients are depressed for this one because it is very hard to act. There is something on your body which is like the drainage, or the one is the caca, but it's only in the pouch. So you have to help the patient to accept and help them to do this self-care also for themselves. This is the article that we require. Ito siya. Now, how to clean the tray containing. There is a Macintosh with roll sheet. There is a kidney tray or paper bag. There is a pair of clean gloves. There is a colostomy bag. There is a basin with a warm tap water. There is a ghost pieces of ghost there. There is a ghost pad or tissue paper. There is a skin barrier, stomach measuring guide, pen or pencil, and scissor, and bedpan. Now, the procedure is that you have to gather all the equipment. Why? Why you gather the equipment? To ensure everything that is rendered to render the care of the patient. You have to encourage the patient to look at the stomach. It encourages the participation in the stomach care for them. You have to explain the procedure to the patient. You have to provide privacy to gain confidence of the patient. Perform hand hygiene and wear gloves. For smooth performance of the procedure, you have to wear the gloves. And spread Macintosh and roll sheet to protect the linen. You have to remove the used pouch and skin barrier gently by pushing the skin away from the barrier. Why? To reduce the trauma, jerking, skin irritation, and cause you tear. And also to remove clamp and empty the content onto the bed, rinse the pouch with tepid water and or normal saline. This one, discard the disposable pouch and paper bag to minimize the odor of the growth of the microbes. Also the difference. Now, you have to observe the stoma for color, swelling, trauma, and healing. The stoma should be moist and pink. Why? You can find out if there's any complication. You have to cover stoma with gauze piece to prevent the fecal matter from contracting with the skin. You have to clean peristomal region gently with warm tap water using gauze. So stoma surface is highly vascular. Skin barrier does not adhere to wet skin. Do not trap the skin. Dry by pat skin. You have to remove the gauze and clean the stoma with gauze. Now, to empty the stoma pouch also, before you start, you have to put a cap or a squeeze bottle to rinse the pouch. And then you have to place a piece of toilet paper on a surface of water in a toilet to prevent splashing up when it's already empty, the pouch. The purpose of that is what is for cleanliness and control of the odor. You have to empty the fecal contents to prepare the bowel for surgery or diagnostic procedure. Also for regular cycle for stool examination. You have to prevent accidental emptying of the bowel. Now, these are the procedures of ostomy. When you are doing, you will need a plastic irrigating container with long tube and a cone to introduce water into a colostomy. You will also need an irrigation sleeve that will direct the output into the toilet. You will need an adjustable belt to attach the irrigation sleeve and a tail closure for the end of the sleeve. Now, choose the same time in each day when you will not interrupted to irrigate your colostomy. Fill the irrigating container with about 15 to 50 ounce or 500 to 150 ml lukewarm of water. The water should not be cold or hot. It should be warm. The amount of water in each person needs to put the irrigation container varies. Ask the caregiver how much water you will need to irrigate, and then hang the irrigation container on a height in which the bottom of the container is level with your shoulder. Sit up straight on the toilet or on a chair chair next to the toilet. This is how it looks like the irrigation tube or a cone for the colostomy. Now this is one how you irrigation cone and to the stoma. This is the fluid, approximately 500 to 1,500 ml. And then this is the catheter. This is how it looks like to irrigate. Now, how to change the pouch.